I'm very excited to have representatives from public health schools and programs from all across the country here. Each of the representatives will first take 1 minute to introduce themselves and their institution, and then there will be a question and answer session where I will ask the panelists questions that were sent in by the attendees. If you have questions you would like to ask, please wait until near the end of the session. Let's start with Ms. Betsey Asher and just go down the line.
Thank you, Vivian, and thank you all for coming. My name is Betsey Asher. I'm representing the Columbia University Mailman School of Public Health. We offer several different master's and doctoral programs in 6 different academic departments. We're located in New York City, in Upper Manhattan. We're part of Washington Heights and part of our medical center campus. So we're located around the corner from New York Presbyterian Hospital and right down the street from our medical, dental, and nursing schools. We were established in 1921, so we've been around for a while. We have a very diverse student population of about 1,300 coming from, I think, almost every state, and I think a quarter of the student body is international. So it's a nice mix of people, and I look forward to answering your questions later.
Good afternoon. My name is Dave Clark. I'm the Assistant Dean for Student Affairs at the UCLA Fielding School of Public Health in Los Angeles. We've been around about 53 years. We're a mid-sized school of about 600, but the most important stat is our faculty-student ratio of 9:1. So we're kind of like a small private school tucked within the major Research One University of UCLA. We offer MPH, MS, PhD, and DRPHs in all 5 of the areas, but something that we've seen more and more students become interested in are our joint degree programs for people that want to have a little bit broader experience. So we have 10 joint degrees ranging from medicine, law, business, Asian American, Latin American, African studies, Islamic studies, and Masters of Urban and Regional Planning. I missed one, but we'll figure it out later. But what we are really looking for are people who are passionate to come join us in this fight to make sure that there's access to healthcare for all, to make sure it's quality healthcare, and to be innovative and creative and really who want to change the world.
Good afternoon, everybody. My name is Rachel Foltz, and I coordinate graduate recruitment and admissions at The Ohio State University College of Public Health. The vision of the college is really to be a leader in public health education and research, and to have a local impact with a global significance. So a couple things about Ohio State is that we have 7 health sciences colleges, all centrally located on the Columbus campus, which is in Columbus, Ohio. And so we do a lot of collaborative research, collaborative disciplines, joint degree programs, and so I think that's one thing that makes us a good choice among many good choices here. As far as the degrees we offer, we have a Master of Public Health, Master of Health Administration, Master of Science, and PhD programs offered in a number of different specializations, but we are, of course, always looking for outstanding students. Even though we are a state institution, about 25% of our students came from non-Ohio states last year, so maybe you might be one of those.
Good afternoon, everyone. My name is Jan Gascoigne, and I'm the Assistant Dean for Student Affairs at the Colorado School of Public Health. And the Colorado School of Public Health is a collaborative school across 3 different universities in the state. The University of Colorado Anschutz Medical Campus, which is located in the Denver metro area, Colorado State University, which is located in Fort Collins, about an hour north, and University of Northern Colorado, which is located in Greeley, also about an hour northeast. Our university allows students to get connected with the top faculty across our entire state. We offer certificate programs, MPH, Master of Science, PhD, and DRPH programs. We also have an online MPH, which is in leadership and public health practice. And our goal as a school, we're actually the newbie on the block. Our school got launched in 2008, so we were a number of programs across those 3 schools that became a school of public health. And so we are looking for top quality students who are interested and passionate about public health. And one of the things that might be interesting for students of California is we're part of the WRGP program. So students who come from California to the Colorado School of Public Health receive in-state tuition with us.
Good afternoon. My name is Assefaw Ghebrekidan, and I am the Public Health Program Director at Touro University, California, here in Vallejo neighborhood. Our program is new. It's just about 10 years old, and there are certain unique features about the program. The first thing we tried to do is we developed what you call a joint program of PA and MPH, where we try to integrate the public health curriculum and the clinical curriculum into one. So students who join the program have to get both degrees. The aim is really, as you all know, it's time to connect health and disease into one, right? It's our attempt is really to make sure that the service of the individual and the service of the community are not separable professionally. So we offer this MPH, and we have two concentrations. One is community health, and the other is global health. We have established institutional links with 3 major countries, Ethiopia in Africa, Bolivia in Latin America, and Cambodia in Asia. And we try to integrate global health with community health as well. Thank you.
Hi, everyone. My name is Leslie Vink. I'm the Director of Recruitment for the Johns Hopkins Bloomberg School of Public Health. We're located in Baltimore, Maryland, on the medical campus with the Schools of Nursing, School of Medicine, and the main Hopkins Hospital. We're the largest school of public health with over 2,000 students enrolled. We have 6 different master's degree programs, 3 different doctoral degree programs. Our MPH is offered as a full-time 11-month program as well as an online program. And we have students from over 80 different countries and really degrees for students coming at every different point in their careers and experience levels. And I think the thing that probably sets us apart is our size. In terms of the resources that are available to you, no matter what you're looking to do. We have combined degree programs, and also if anybody's interested in the Peace Corps, we have the relationship with the Peace Corps where you get to basically kind of pick where you're going during your program. But there's a lot of, we're all great schools up here, and I think that a thing I like to encourage is to do the research like we're all doing here, and finding that best fit, which is important. But like my colleagues, we're looking for students who are really passionate about the field and excited, and finding that fit for you makes you a strong applicant to any of our programs.
Hi, my name is Stuart Wann. I'm here with Claremont Graduate University's School of Community and Global Health. I'm glad to be sitting next to the largest school of public health because we're probably the smallest up here. We have about 85 students. We're an intentionally small and intimate research setting. We have a number of degrees that we are offering. A PhD program in health promotion sciences, an MPH with a handful of concentrations. We also have a few dual and joint degree programs, dual degrees with our Drucker School of Business, MBA, MPH, a dual degree with our School of Psychology, and that's a MA, MPH. And then this year, 2 new joint degree options, a Master's in Health Evaluation and a Master's in Positive Health Psychology. So we're excited to be launching those in this upcoming fall, 2015. We are located in Los Angeles, if I didn't say that already, sorry if I did, about 30 miles east of downtown LA. And like everyone else up here, we are looking for people who are passionate about public health. We're located very strategically in an area that is in high need of public health practitioners. So our students get a lot of, get their hands dirty at the very beginning and really get involved in the local communities. So.
Thank you, Mr. Wann. So our first question is, do you value leadership experiences over research experiences? And this is open to the whole panel. Leadership experiences over research experience? Do you value one over the other?
I think they're both really important, you know. Any kind of leadership role that you play, whether it's in a student organization or something along those lines, and especially if it's, you know, health related, is going to be great. Research is also great. I mean, either or both is going to be helpful in informing you in terms of your decision to pursue public health in what area of public health.
I think whatever you're doing experience-wise or anything, it's what we're looking for is that what you're doing is reaffirming your interest in public health. So I always say we don't have cookie cutter students in public health, and we don't want cookie cutter students. Students that are in this field, especially because it's so broad, are coming from so many different backgrounds. So it's really a personal decision what is more important for you, and that'll just naturally refine your interest and make you a stronger applicant for our programs.
Okay, so our next question, do you actually contact people who write the letter of recommendations?
Do we contact? We do not contact them. We take the letter of recommendation on face value. So make sure you get really good ones.
It's important.
Yeah, because we don't call them. We don't have time.
Okay, so Ms. Foltz, what do you consider to be a strong applicant?
Sure. So a strong applicant to Ohio State University is going to absolutely have that passion and drive for public health that everyone has sort of emphasized. I think that these students are also going to be, of course, sound in their academic preparation for the programs through their undergraduate preparation, or even if you've done some like internships or shadowing experiences, that would be excellent. Particularly with the public health programs at Ohio State, our faculty are clear that they do not have a certain undergraduate major that they seek. We will have students from a very diverse background, whether that be health sciences related fields or other like social science types like the sociology or psychology. Those are also excellent preparations. So what we're really looking for is those students that have the fit, have the drive, and then also have some academic or professional experiences that complement not only their interests in the field, but seem to be a good match for our programs and our faculty interests.
Mm-hmm. Dr. Gascoigne, do you have anything to add?
I would say similarly. We really look at a holistic application, so we're looking for a minimum GPA of around a 3.0 or above. We're looking for 50 percentile of GREs. And then we're really looking at how you tie your personal statement to interests with the programs that we have at our school. So getting an understanding that you know what you're applying for and that this degree program really matches your career interest and that we actually have a program that can help you succeed in that area. So we're looking at that. We're looking at your letters of recommendation and who those are from. We really prefer them to speak directly to your ability to do the academic coursework, and then, of course, matching that with any type of professional experience that you've had. And then finally, our other component is looking at your experience professionally or internships or volunteering. Even if you work in an area that is not public health, I think it's important to demonstrate what skills you're learning at whatever type of work you're doing and how it might tie to your work in public health. So if you're working in retail, it might be that you're learning skills about working with customers or consumers. That really translates then to community and behavioral health or something like that, where you may be working with communities and a diverse group of people and learning and able to talk to them. So we're looking across the board at how all of those pieces come in. Like everyone on the panel has said, all of our applicants are unique and individual applications that we look through and try to find a best fit and see if we're the right fit for the student who applies.
Thank you, Dr. Gascoigne. So our next question is, what is one major misconception students have about applying to an MPH program or school?
I would say for ours, most students who think that they shouldn't be applying think that they need to have a background in public health, that they need to have studied public health as an undergrad. This field of public health is such a broad field, and so there's a lot of different things that you can bring, even if you studied anthropology. There's a lot of different things you can bring from your background. So even if you didn't study public health in undergrad, there's nothing that you need to do for at least our program, and I think most programs, to prepare to go into a master's of public health or a related field, but just need to have that passion and desire for future in public health more than anything.
I also, you go. Me? Okay, thank you.
It's the same thing, go.
I think a lot of students who are thinking about public health have also been thinking about medical school, and the application process is very different, and I think there's a misconception there. With medical school applications, oftentimes the education you'll get at medical school will be almost identical. The differences will be the teaching hospital attached to it, the caliber of the faculty, the caliber of your fellow students, but the education is often very much the same, whereas schools of public health can be incredibly different. When applying to med schools, you've got to maybe throw 40 applications out there in hopes of getting into a couple. Whereas if you do your research properly when looking at schools of public health, you find those schools that you'll have a good fit with, and then only apply to a few and probably be more competitive for those. It's a totally different process. And I also think, again, there's a very holistic review of application files as opposed to other professional schools like medicine where they have cutoffs and things and need to weed people out right away. If your application is complete, it will be reviewed. So I think that's a misconception. Applying to public health is kind of different. Is that what you were going to say?
That's what I was going to say. Thank you.
No, thank you.
Thank you, Ms. Asher. So our next question is for Dr. Ghebrekidan. In order to become a stronger applicant, what do you think students should do during their gap year, if they have one?
Well, I think applying for the public health program, as you said, is different from other professions. Because public health, as you know, is a profession of the heart. It's not a profession of the brain as such, because health is everything. And one of the challenges that we have as public health professionals is to define our profession, because public health encompasses everything. So when you apply for public health, of course, we would like to find out whether your heart is in the right place. In a sense, if you have a public health degree, we expect you to have a sort of a clear understanding what the community is and what serving in the community is all about. So otherwise, a good artist can make a good public health professional. A musician can make a good public health professional. Anybody can make a good public health if you have that heart for public health.
Can I add something?
Of course, go ahead.
I think gap years are important if maybe you're not quite 100% sure that public health or this area of public health is really what you want to do. Maybe if you're torn between one or two areas, maybe a gap year might be a time to go out and try working or volunteering in one of those. Because what's going to happen is you're going to either realize, yes, that's exactly the right one, or that is not the right one. And that is not a wasted year if you find out that's not the right one. Because going into a graduate program, it's hard, it's a lot of work, it's a lot of commitment, it's a lot of time. So you might need a year to kind of make sure you know exactly where you want to go and maybe do some more research on the different schools and peel those onions back to figure out exactly where my fit is. So I don't see real cons to a gap year. There's a lot of pros.
If I can just add something too. I think a lot of times when you're looking at public health jobs or opportunities, they're looking for an advanced degree or something, and I'm sure we all get the same question of, well, what counts? And just along what Dave was kind of saying, go with your gut on this and go with your passion. And even if it is just shadowing somebody, or if it's volunteering, or if it's just trying to participate in whatever way you can on a research project or something, that will all slowly help refine your interest. I spoke with a woman a few years ago who was so excited about the field, but she ratted off 7 different core areas of public health, and she was ready to apply, and I had to say, you're not quite ready there. Anything you can do, just as Dave said, is to slowly refine your area of interest, because you are a stronger applicant when you find the right fit in any of our programs, and that's what makes you a strong applicant, because you're able to speak in your personal statement, identify what you need from the school in order to go save the world.
Thank you, Ms. Vink. So our next question is, what is the most memorable response you have received on an application? This is open to the whole panel.
So can you say it one more time?
The most memorable response you have received on an application, if you have any.
I would say if you're asking, I think the memorable things that we hear are really the personal passion that's written through personal statements. So I can't pull one out specifically, but I would say, as faculty and we're reading through the applications, people really stick out in your mind when you talk about experiences that you've had and how that lends itself to your passion or what you want to pursue in public health. So it may be that someone was in the Peace Corps and did a specific program, and that really enlivened their interest in a specific area, and that's why they're applying. So I think, making your application personal to yourself. We don't need to go into deep personal stories, but I think an overview of what drew you to public health, and then also on the other side, how our program would help you pursue where you want to end up. So we're also looking for, where do you want to be at the end of this, kind of? And if you don't have a true idea, we don't need that specific, but an idea of why you're coming to this graduate program and where you want to end up would be really helpful.
And I'd like to add, and I think this could also go under the misconceptions question as well. A lot of times when you're applying to undergraduate programs, you're writing your essay and you're trying to figure out how to make yourself stand out. Because again, with undergraduate institutions, a lot of them are huge and they've got tons of applications and you really want to make yourself look special. You are special. With professional and graduate school, it's not so much about how you stand out, how you make yourself memorable. It's how you show them that you're going to fit in, that this is the right program for you considering your interests and your career goals. So I think, just to kind of back up what you said, that's what it's all about.
Just as an anecdote, I was interviewing one student, and she was from Burma originally, and I asked her, why are you interested in public health? She said, I have no idea why I am interested, and I have no idea about public health. The only thing I know is that if I follow this course, it might take me back to my community. And finally, actually, she ended up going back to Burma after graduation. Now, that is a perfect candidate for MCHES. Someone who has no idea, actually, but with certain purpose, connect to his community or her community.
Maybe I'm darker than all the rest of the panel, but when you said what's the most memorable, I remember the bad ones. Those stick out like you wouldn't believe. Like when we get the personal statement, say, I really want to go to Harvard. Great, apply to Harvard, don't apply to me. If there's typos in your personal statement, or if the letters of recommendation are 2 sentences long and say, he was in my class, he got an A. Those are the ones that I remember because they immediately go to the wrong pile. So be careful.
Yeah, and also along those same lines, poem quotes and song quotes, I'm talking about kind of your personal statement piece of your application, because I don't know, but for our school we don't do a ton of interviews, so what we get on your application is that's it. But your personal statement, you need to get to the point. We don't want to fill up space on those beautiful quotes, which may have been inspirational to you, but that doesn't matter to us. You need to get to the point and be clear and concise. As to, again, this whole fit thing, and tell us your story.
Thank you, Ms. Vink. So, Mr. Wann, how often do you encounter reapplicants?
Reapplicants?
Yes.
As in they weren't admitted before and then
Yes.
they're applying again? Not often at all? Sorry, that's probably not the answer you wanted, but we don't really encounter too many reapplicants.
So, oh yeah, go ahead.
No, I think reapplications for us, because we do get a few every year. For me, it shows persistence, tenacity. It shows I really want to be in your program. So that's what it shows me. But what I don't like to see is the exact same application. I want you to understand the denial, maybe call us, talk to us, I'll tell you exactly why you didn't hit the bar. Then go out and do something to rectify that. If you were low on quantitative, go to a community college, take a couple statistics course, come to extension, take our actual courses, but as a non-degree student. Show it, prove to us, I can do this work. But don't just turn in the exact same application again. Had that 3 years in a row, and believe me, still not getting in.
I'd like to change my response. I don't like to see the same application 2 years in a row. Is really. So what Dave said, I agree with.
I think we all agree with that one. Yeah.
Okay. Ms. Foltz, what is the most challenging portion of the application process in your opinion?
I'm sorry, can you repeat that?
What is the most challenging portion of the application process?
Okay. So we participate in SOFAS. How many other schools here? Okay, a few.
Halfway.
Sort of, maybe, yes. So not all schools are SOFAS schools, but we do happen, and that is the Schools of Public Health application system, which is a centralized application. And so what I hear from students can be challenging is the coursework entry portion, just because it takes time and you do have to be detailed in what you input into the application, because if you input it and it's not what shows on your transcript, then you will hear back as to needing to correct that. So I think that just paying attention to the details when you apply to a university is key, because you don't want a silly mistake to delay your application and cause you to miss an important scholarship deadline or funding deadline. So whether you're SOFAS or or not, I would say that just make sure that you have read through everything clearly and completed it in its full required form.
Can I add to that also? We also participate in SOFAS, and one of the things I would encourage is that you apply early. So your applications go through the central system there, and we don't get a final version of your application until the materials come through and are verified by them. And sometimes that takes longer than you would expect it to. So I would encourage you to really look at the applications for the schools, see what you need to pull together, and investigate how long you have until there is a deadline, and then really back it out and try to apply at least a month in advance so that your application comes in when everyone else's does, and there's an opportunity for it to be evaluated with the other applications. So, and the SOFAS cycle opens in September, so you can all actually leave the conference and start applying right now. And then deadlines are typically in the new year, or I think some maybe in December. Ours is January 15th.
Or December 1st.
We are too.
So you definitely need to apply to UCLA right now, right?
Or yesterday.
So the next question is, if an applicant does not get accepted, what is the best way to determine what parts of their application need to be worked on? And this is open to the panel.
Meet with us. I mean, we have a lot of students who come in for advice and counseling prior to reapplying, as Dave was saying. Yeah, we're happy to go over that with you and figure out ways that you could strengthen your application for a reapplication.
Maybe what you don't understand about the process, especially for us, and you guys can fill in, our faculty in the departments read and decide. The admissions office does not. My job is to make sure you are able to put your best foot forward. So if you want, you can send me your personal statement, I'll read it and send it back to you and say, a little off base, I didn't understand that. So it's my job to help you have the strongest application to go forward, because I don't make the decisions. So you can ask me and you can call me and say, my GPA is a little low. What do I say? How do I couch that? What do I do? Because that's my job. So I shouldn't be the scary one, because the faculty read it and they decide.
They're the scary ones.
Yeah, they're the scary ones. But I don't know if that's the same for all of us.
It's true.
But just, you want to call the school. How do you decide? Who decides? Is there someone there who can be a resource for me as I fill out my application? Ask us. This is why we're here today.
Exactly.
I would agree. If you're applying to a number of schools, you have a strong GPA, GRE, the first place I would start is with your personal statement. Each of us has explained that we're looking for students who are passionate about public health, that our faculty are looking for students that are passionate about public health. So have a friend, faculty, mentor read over your personal statement and say, hey, does this really convey my passion for public health? if everything else checks out, that's usually a good place to start, because fit is going to be an important issue for each school up here.
I agree, and I just add also that many of your universities have a writing center or a career center, and I encourage students to take their personal statements and their applications there to have a look as well, so it's someone outside who can really help you shape that.
I think too, when you look at your application, look at, is that the story you want told? You know, is that, and looking at your letters of recommendation and looking at your test scores and all that stuff, your personal statement is the one piece where I think I can probably speak for all of us. That's where we want you to really take your time on that and really craft it to represent you again. But look at where maybe there's a piece of that whole pie of your application where you're like, this isn't quite telling my story how I want to, and how can I maybe guide a recommender to talk about those abilities or something like that. So really, again, it's a holistic review of your application, so take advantage of that and be able to kind of fill in areas where you feel like I need to talk about this more, I need somebody to be able to vouch for my abilities in this area, in that type of way. Just a suggestion.
Thank you, Ms. Vink. So last session, we weren't able to take questions from the audience, so this time I'd like to ask the panel if you have any final advice before turning it over to the audience.
Just want us to go down?
Final words of wisdom?
You want to go? Yes.
Let's start at that end.
Go ahead.
Okay, well, don't reapply with the same application. Any advice? Okay, well, I would say that, especially if you're earlier in your college career, I wouldn't advise just making every decision in your life based on where you want to go to grad school, what public health program you want to do. If you're doing that, then you're probably going into this field for the wrong reason. This is a field about heart and passion, and really that should be any field that you go into. So make decisions that are going to benefit you as a human being and make you a better person. And you know what? That will help prepare you for graduate school in a field of public health. If you aren't getting experience in the public health field, whether it's in research or volunteering or anything, then maybe you're not really interested in public health, and that's okay. But you should really pursue your passions and find out where they lead you, rather than pick kind of a final destination and try to fit your curriculum to go into that world. So
That's really good advice. I think more on kind of a generic side is that this field is booming, and it's growing, and it's changing, and it's really exciting, and there's so much that you can do with it. And I'm sure we all get the same question of, well, what can I do with a public health degree? And I almost want to always turn around and say, well, what do you want to do with a public health degree? Because that's really what it's about. We have students that come in from so many different backgrounds and twist and match things that I would never imagine. And I think it's, as the field continues to evolve, I mean, my gosh, there's I don't even know how many schools in public health and programs right now, but I've been working at Hopkins for 8 years, and the way it's grown in that short amount of time is just phenomenal. So I think it's a really exciting time, and there's so many resources out there. It can be, especially when you're at the point of kind of like, I know I like public health, what do I want to do with it? But you really have to dive in, and even if it's just looking at different websites, or checking out what people are doing in the field. We always say when we do some of our recruiting events, pick up, wherever you go in whatever city, if you pick up a newspaper, 99% of the time you're going to see a public health issue on that front page. And it's a great field to be in, and it's exciting, and I enjoy, even though I have a small part in it, but it's wonderful to get to meet prospective students who kind of come to the table with these ideas. You're like, well, you can do that, you know, and there's no limits, there's no boundaries on what you can do in this field.
Well, in the newspaper recently, Ebola is becoming. Well, the advice I have for you is really, if when you make a decision, you know, it's a decision of passion, and something, it's a kind of a turning point in your life. What do you want to do with your life? Now, that answer is very, very important. I mean, if you decide to have a say in the community aspect of our public health, not only locally as well as globally, then public health, MPH, is an important tool. If you decide to be a specialist in some particular field, then, and focus on that, then MPA public health will not be necessary, in a sense. So it all depends on what you want to do with your life. Now, in our case, what we have tried to do is, as you know, yeah, I think Leslie is right. I mean, public health is becoming popular, but it's also becoming equally popular to have a joint degree. For example, the PA-MPH program that we have, although we accept 40 students a year, we get about 1,700 applicants. And when we ask them why they want to join this program, they say because it has a public health component. They want to have a full understanding of disease and health. Although they are one, we have separated them into two professions. So if you are interested in that kind of service where you will focus on contributing to the community. Our graduates, 70% of them practice in community-related services. Now, the other thing we try to do is global health and community health, connecting the two. Here, Ebola comes. We are all neighbors now, and we cannot have a healthy United States unless we have a healthy Liberia. That's the reality. So if you are interested in these things, you know, it will be good, but it has to have the passion. You know, you have to make a decision, important decision in your life.
I echo everyone's passion and focus on public health as a career. I'm going to go to something a little more practical. As you're really looking at your program and you've applied and you've narrowed down your schools, I would really encourage you to get connected to the faculty there, have a chance to speak with them, and particularly in your area of interest. I would encourage you to visit the schools that you're interested in, get a feel for what that campus and that community is like. And then I would encourage you to reach out and ask to talk with students who are in that program so that you have a chance also to talk with those folks who would be your peers in the program so that you get a feel for what you're going to step into. And I'm sure all of our programs would welcome you to come for a visit, would welcome the opportunity to connect you with a student in an area that you're interested in and or an alum. So we also have folks who have graduated from our programs all over the world who we could connect you with who might be doing something that you are really interested in so you could explore it further. But I think we would all be very open to the opportunity for you once you've started to narrow it down to really get a chance to know who we are before you come along and see if that is a fit for you.
Yeah, I think I want to add just a little to that when you mentioned about alumni, because we have a tremendous alumni network around the nation and around the globe, and even though Ohio State or Columbia or wherever might be far from California, you know, don't be afraid to ask if there's an alumni in your area who you could sit down with, not only to find out about your school of interest, but to do some informational interviewing and talk with them about their career and how they got to where they are in the field, because I think you can learn a lot from those who have sort of come before you in public health, and that doesn't mean your path has to be the same as theirs, but it can give you an idea of the diversity in terms of careers and of, you know, just journeys you can take in the field.
I'm going to do a little bit more practical like Jan did, and this is for letters of recommendation, because this is a big piece of your puzzle. And your application should be, think of it strategically. You're going to give us data, you're going to give us your personal story, but then these letters of recommendation should really reaffirm everything else. So someone else is telling us, yes, she does have that passion, or yes, they were an amazing student, even though the GPA might be up there. So make sure you look at it strategically. So what I'm going to say, basically for us, you have 3 letters of recommendation. What I would do is go into the person, make sure you have a very strong personal relationship with them, and ask, do you know me well enough to write an outstanding letter of recommendation? And use the word outstanding because it puts it out there that you want a really good one, right? And then you're going to give them your personal statement, you're going to give them your resume, you're going to give them a little bit about the school you're applying to. And if Betsey, Rachel, and Jan are my letter recommenders that I've asked, I'm going to give Betsey 3 bullet points. Would you please talk about these 3 things that you know about me? Rachel, would you talk about these 3? Jan, would you talk about these 3? But what I've done is I've crafted and I've given separate ones to each person. So now my faculty who's reading my application has 9 different bullet points. Because if you don't help guide them, they'll all write kind of the same letter. And I just want you to be able to look at strategically look at your application, like, now who needs to reaffirm which pieces? And help guide them. As a letter writer for 18 years getting you all into these programs, it helps to have bullet points, believe me. And if they don't agree, they won't write it. But 10 to 1, if you have a good personal relationship and they know you well, they'll write it.
So I agree with everything that everyone has said. And my words of wisdom, I guess, don't let people talk you out of it. You know, when you're pursuing professional programs, so you go to medical school and you know you're going to be a doctor. You go to law school and you know you're going to be a lawyer. Public health, because it's so broad in scope, it's hard to define. And I think sometimes when you tell your parents or your friends, I'm going to go get a Master of Public Health degree, they're like, what? What are you going to do with that? You can do a lot, as all of my fellow panelists have said. It's a really booming field. It's very exciting. There's a lot of opportunity. We need trained public health professionals, so don't let anybody steer you in a different direction. If public health is your passion, that's what you should follow.
Thank you, panelists. Does anyone in the audience have any questions they would like to ask? Yes, go ahead.
This question is kind of directed toward Mr. Clark, just consistently smartly. But it's kind of just regarding the dual degrees between MPH and JD. So I can see pretty clearly how something like an MPH in public policy or something relates directly to law. I just don't know if there's a link or a link that I don't see between one of the more science-oriented MPHs. I get a lot of one of the focuses is common science, environmental health science, and that one's a little more of like the natural biological sciences. So does something like that have a strong connection to? I'm just wondering why there's a dual degree with the JD. Like, what sort of thing would do that? Would you use the knowledge of both degrees?
So, well, we don't have that yet, but we're working on it. But you know, there's a number of areas you could think about. Environmental health and the issues. When I think of our state right now, we have issues around environmental health and oil and gas exploration. We have issues around. We now have marijuana legal in our state, so we have a number of different things that intermix with health and marijuana. So there's a number of different areas across public health where law really would be a great combination. So those are just a couple off the top of my head.
A couple that just graduated this year. Eli went back to Washington, D.C. He wants to do public health law, but he wants to do it on Capitol Hill, so he's working for our senator right now doing that. We have a woman who just graduated. She was very concerned about reproductive health and abusive situations for women. So she's doing it from the legal standpoint. We have some students right now, I don't know if y'all know, but the San Fernando Valley is the porn capital of the world. So our students have been trying to get the porn industry to add condoms into their every single shoot. And they took it from the public health perspective of, that's just the right thing to do, you shouldn't spread disease. Well, the law students came together and said, wrong tact. The tact is, you're not protecting your workers. So they took it from the legal standpoint of a workers' rights issue, and they passed the law. And now in Los Angeles County, you have to wear condoms during the porn industry. So that's kind of like taking law to use for public health purposes.
Thank you, Mr. Clark, and thank you for your question. And I would like to conclude the panel by thanking the panelists. You're welcome to come up to the panelists. I'm sure they'll stay for a little bit to ask your questions. Please give them a round of applause.